What's up, beautiful people? Another day, another study. Determining magnesium status can be pretty difficult. The best way is to have people track their nutrient intake and then see if they're intaking enough magnesium. In the studies I've read, the average American gets about 240 or so milligrams of magnesium a day, well below the 320 that's recommended for women and 420 that's recommended for men. However, getting people to track something, my favorite app is Chronometer. It's pretty hard. Most of the people I recommend it to don't do that. So relying on blood biomarkers is a little bit easier because all you have to do is draw blood. However, most of the magnesium in our bodies is in our bones. So we're only capturing a small portion of the magnesium in the blood. So people have proposed different ways to quantify magnesium status. There's a questionnaire that's been utilized and I've seen in studies. But one of the things that can be utilized is a ratio of calcium to magnesium. These things are antagonists, and the balance between them helps regulate important aspects of our physiology. So this review article examined 10 studies in the association between calcium-magnesium ratio and disease status. I have the cutoffs down below as what they were for adequate, mild depletion, moderate depletion, serious depletion. And then looking at certain disease states, patients with metabolic syndrome are found to be more likely to have moderate to severe magnesium depletion. This is something that I've seen in practice where people have lower magnesium levels, and we tend to see improvements in some metabolic markers with magnesium supplementation. In atrial fibrillation as well, atrial fibrillation is a condition we know that is associated with magnesium. Magnesium is very important for the heart rhythm, maintaining a normal heart rhythm. And it's found that the calcium-magnesium ratio showed that 95% of patients in this one study may benefit from magnesium supplementation. Patients with COPD showed moderate to severe magnesium depletion compared to nearly adequate levels in non-healthy smokers. And then also patients with kidney stones. I've talked about this before, how elements like magnesium, potassium are very important in helping to prevent kidney stones. So people with kidney stones showed more likely to be magnesium depleted than people without kidney stones. So this is something that I will check. I will use this ratio in assessing magnesium status. Like I said earlier in the video, I would prefer to get nutrient intake through an app called Chronometer. Doesn't happen very often. So using these blood biomarkers and questionnaires is something that is easier to do when you're working with patients.